Oh, good morning, everyone. I'm Ethan, moderator for this webinar. I welcome everyone for today's webinar, Harassment and Bullying, a Sepsis in Healthcare. I would now like to introduce our presenter for today, Dr. Susan Strauss. Dr. Susan is a national and international consultant, speaker, and trainer in organizational effectiveness and management development. Susan has a doctorate in organizational leadership, a master's degree in community health, and is a former RN. I would now like to hand over the floor to the speaker. Over to you, Susan.
Thank you, Ethan. Greetings, everybody from Minnesota. So let's take a look at today's objectives, and I'm going to be going fairly quickly, and I've got some handouts that are included. So one, we'll discuss sexual and other protected class harassment. We will examine some healthcare discrimination and harassment court decisions. We'll demonstrate the nexus or the relationship between bullying and harassment. We'll look at some of the causes and contributing factors as it relates to the healthcare environment. We'll identify the impact of harassment on the victim, the work unit, the organization, and the patient. We'll discuss the proper procedure to follow if you're harassed or bullied. And I'm going to be referencing, it's in the references, the JCO's Centennial Events Alerts on behaviors that undermine a culture of safety and preventing violence in the healthcare setting. And we'll identify management's role in the responsibility of the prevention and intervention of harassment and bullying. And we'll discuss how process improvement and risk management and the hospital culture are integral in any hospital-wide prevention and intervention strategy. So why is this important in healthcare anyway? Well, it has to do with quality patient care. It is a legal issue, at least harassment is. It costs money when either harassment or bullying are occurring. It's certainly an ethics issue. That's a no-brainer. So there's a number of implications. So there's a number of laws, both federal and state, that you need to be aware of. Title VII is your Civil Rights Act, and it also includes the other laws that are on your screen. What is a sexual advance? What is a sexual favor? What is conduct of a sexual nature? What causes these behaviors to become illegal? Now, the hostile environment, what do we look at to see if it's the environment? And by the way, hostile environment is a legal phrase. We use it when we're talking about bullying as well, but it is a legal phrase that only applies legally to harassment. And these are the things that we look at to determine whether or not a hostile environment has been created in your work environment. So these are some of the types of sexual misconduct that would be severe. So harassment does not need to be directed at a particular worker. Other workers who hear or see the harassment are also affected. The context is considered. It is class-based epithet. It's derogatory comments regarding their class. It's using code words like, oh, you people. An example would be pornography. There's also something called a third-party harasser. And this is who can also harass your employees. And you are responsible for the third party as much as you are for your employee. So what are the guidelines that you should use to determine if you are harassing someone? So let's look at this one. If what you're doing, would you want that done? Would you want it printed in the newspaper, in TV, or on social media? Is there equal power between you and the person with whom you are interacting? And this doesn't have to be just formal power, but informal power. Now, would you behave this way if your significant other was standing next to you? Your wife, your partner, your spouse, your children, your parents. Would you behave this way? Would you behave this way to the target that you are directing your misconduct to if their significant other was with them? Would you want somebody to act this way towards a person with whom you were in a relationship? And is there equal initiation and participation between you and the person with whom you are interacting? So let's look at bullying. So this is one definition of bullying I'll let you read. So what are the causes and contributing factors of bullying? Well, it's a power imbalance. You must look at your processes and structure. And then change plays a big role. There's informal alliances, competition, reward system. There might be problems in conflict. There might be some ambiguity that goes on. Tolerance and even reward for the misconduct. That's one reason JCO came up with their culture. Low satisfaction with management. So let's look a little bit more at causation. What's going on with the perpetrator? Why does that particular bully, in this case, attack this victim or target? Then we have to look at the organization. What is going on with the organization that allows this behavior to continue? But then we have to look at the healthcare system. As I mentioned earlier, bullying and harassment particularly are not unique to your organization. It is system-wide. Here are some examples of bullying. And these examples of micro-bullying, now these are some old research studies, but I wanted to include them. This was one, and you can tell how old it is, that showed that the healthcare environment actually supports the toxicity, even if it's indirect in the policies, and that informal networks also support the dysfunction, and that in healthcare, we've had a focus on punishment and blame. And that's why the just culture came about many, many years ago, to not focus on punishment and blame, but to focus on instead, what can we do to deal with what happened? So this tells you what the effect is of bullying and harassment. And I did include school performance. And this is something else that I recommend that you access. It deals with patient safety, etc., and good communication. And as you can see, there's a lot involved with harassment and bullying. I hope this was helpful for you. And thanks again for joining us. And Ethan, thank you as well.